Claire Evans, registered general nurse, saving the NHS, has a question. She uploaded this 40-second clip in January, so let's take a look at her question and see if we can't help her out with an answer.
Hi, my name's Claire Evans. I'm a registered general nurse trying to save the NHS. I've never really believed that COVID is real, and this is why. Answer me this question, people. If in March we had this huge spike in cases and huge number of deaths, how do we know this when we didn't even have a test, let alone a track and trace? We still don't. Our government and leaders know that we didn't, so how on earth did they diagnose all of this COVID-19? Answer that and then tell me it's not a scamdemic. Thank you, bye.
Yeah, so starting in March 2020, there was a peak of SARS-CoV-2 infections in the UK, and there was a corresponding peak in deaths which lasted through to around June. At its worst point, this translated to about a doubling in the number of people dying every week in the UK compared to the average for the last 5 years. To be exact, Claire asked, if in March we had a huge spike in cases and a huge number of deaths, how do we know this if we didn't have a test? Now, I don't want to be too pedantic here, but we obviously know that the spike in deaths happened. The death certificates were filled out and the funerals were held. We don't really need any test to confirm that a lot of people died during this period. But regarding the test for SARS-CoV-2 infection, well, a protocol for a PCR test was published in January, so there was certainly a test available in March. The first 2 cases in the UK were confirmed on the 30th of January, and you can read about how these cases were managed. For diagnosis, they followed the PCR protocol published in Eurosurveillance, and they also sequenced the full genome of the virus and traced contacts, so they didn't have to wait for the NHS track and trace system to be set up. The UK has laboratories and hospitals which are perfectly capable of running PCR tests. As case numbers grew, some specialised labs were set up, not because the hospitals weren't equipped to run the tests, but because they didn't have the capacity. And hospital labs also have a whole load of other tests that they needed to keep running to treat patients who didn't have COVID-19. And scale was the key issue here. Any healthcare worker can trace contacts, and any hospital lab can run a PCR test. They just couldn't run the number of tests and trace the amount of contacts demanded by the pandemic while simultaneously trying to meet their usual workload. In March last year, I volunteered to run qPCR tests at my local hospital after an email was sent out asking for scientists with experience of this technique. And in April, I went for an induction at the hospital lab. I wasn't asked to work any shifts in the end. I think the pressure was eased after the Lighthouse laboratories opened, and not as many staff went off sick as they had feared at first. But they took us on a tour of their qPCR lab and they showed us the new machines that they had bought and borrowed to run tests during the first COVID-19 peak. So when Claire asked, how on earth did they diagnose all this COVID-19? Well, I know the tests were being run. It's a technique I'm really familiar with, and I spoke to the scientists running the diagnostic tests at the hospital. But you didn't need a lab tour. This was all excruciatingly reported by the media at the time. And this is something that I find curious about Claire. All this information about testing, it's freely available online, and if she had more questions, why didn't she just speak to someone at work? It seems a shame that she must be quite disconnected and untrusting of her colleagues who are also working hard to benefit patients in the NHS. I just want to point something else out here. Even if there was no test, even if we couldn't find a cause for this disease, we could still correlate symptoms and track its transmission. Some diseases are really hard to test for. BSE or mad cow disease is a good example. It usually has to be diagnosed by examining the brain tissue of infected cattle after they've been put down. And if we look at the history of HIV and AIDS, there was no test or even any known cause for several years. Cases were still tracked though, and the routes of transmission were mapped, and eventually a virus was identified and a test designed. But there was no need to wait for a test before making the judgment that a new infectious disease was responsible for the deaths of these first AIDS patients. So even if Claire was right and there was no test for COVID-19, that certainly wouldn't prove that this is a scamdemic. A lot of people died and they had a clear set of symptoms, and this mapping of symptoms can be very effective. That's how the first cases were identified in Wuhan even before anyone passed away. So it's not as if we have to feign total ignorance in the absence of an effective test. So hopefully that answered your question, Claire Evans, registered general nurse, and maybe this will help you in your quest to save the NHS. Thank you and goodbye.